Welcome to the deep dive. Today we're getting into canine Lyme borreliosis. If you've got a dog, this is definitely something you want to understand better. And honestly, since it can affect people too, it's good general knowledge.
Absolutely. It's one of those common things dogs can face, spread by ticks. Understanding it helps us keep them safe, and it sheds light on other tick-borne issues too.
Yeah, exactly. So our mission today is pretty straightforward. We've gone through some detailed medical info on diagnosis and treatment,
Right.
and we're pulling out the crucial bits for you. Basically, a clear overview without getting bogged down in all the jargon.
Sounds good.
Okay, so let's start right there. What is canine Lyme borreliosis in simple terms?
Well, basically, it's a disease dogs pick up from infected ticks. It's caused by bacteria, a group called Borrelia.
Borrelia, okay.
And the main thing you'd probably notice in a dog is lameness, like arthritis. That keeps coming back.
Recurring lameness.
Yeah.
Yeah, that would definitely catch an owner's attention.
Yeah.
Are there other signs early on?
Sometimes, yeah. You might see they're off their food, maybe a bit lethargic, kind of depressed. And in some more serious cases, it can cause kidney problems.
Right, and it's mostly dogs, but you mentioned others.
Primarily dogs, yes, but
Yeah.
humans can get it, horses too. It's less common in cats, interestingly.
Okay, so this lameness, this arthritis, what's happening inside the dog's body in the joints?
So the Borrelia bacteria, they migrate through the dog's tissues. And that movement, plus the dog's own immune system reacting to the bacteria, that's what causes the inflammation in the joints, the arthritis.
Oh, okay.
It often starts near the tick bite, like a local skin thing, but then over weeks or months, it can spread out
Spread where?
into connective tissues. Think joints, obviously, but also tendons, muscles, even nearby lymph nodes.
Gotcha. Now, you hear about the bullseye rash in people with Lyme. Do dogs get that classic sign?
That's a really important point. No, they don't. That
Huh.
specific rash, erythema migrans, we just don't see it in dogs.
Huh. So no rash doesn't mean no Lyme?
Exactly. It's a key difference.
Okay. And the kidney issues you mentioned earlier, how does that happen if the bacteria aren't, like, setting up shop in the kidneys?
Right. It's a bit indirect. The dog's immune system makes antibodies to fight the Borrelia. Sometimes these antibodies and bits of the bacteria clump together.
Okay.
These clumps are called immune complexes. They circulate in the blood. And in some unlucky dogs, they can get filtered out and stuck in the kidneys.
Ah, so it's the clumps causing trouble, not the bacteria itself in the kidney.
Precisely. These complexes trigger inflammation, glomerulonephritis, and that's what can damage the kidneys, potentially leading to failure. We usually don't find live bacteria there.
So a positive antibody test isn't automatically bad news then?
No, not on its own. It shows exposure, but the vet needs to see clinical signs or specific kidney-related lab results to connect the dots. It's about the whole picture.
That makes sense. It sounds quite involved. How long after a bite does it take for symptoms to show up? Is it quick?
Actually, no, it's usually quite delayed. In studies where they deliberately infected dogs, it typically took 2 to 5 months for them to show signs of Lyme disease.
2 to 5 months. Wow.
Yeah, so it's definitely not an immediate thing.
That delay is really important for people to know.
Hmm.
So where does the bacteria actually, like, live in the dog's body during this time?
They seem to have a preference for tissues that are high in collagen.
Collagen, like skin, joints.
Exactly. Skin, joints, tendons, the sac around the heart, linings of body cavities, even muscles and lymph nodes. But interestingly, you don't usually find them floating around in fluids like blood or the fluid inside the joints.
So even if it affects different areas, the bacteria itself is kind of hiding out in these specific tissues.
That's the idea. And generally, the actual DNA, the pathology, is mostly found in the joints and the nearby lymph nodes. Kidney damage is serious, but thankfully less frequent.
You also mentioned earlier that some dog breeds seem more susceptible to the serious kidney problems.
Yes, there seems to be a genetic link there. Bernese mountain dogs, labs, golden retrievers, these breeds pop up more often in reports of severe kidney failure associated with Lyme.
So if you have one of those breeds,
Then tick prevention becomes even more critical for you. It suggests their immune system might react in a way that unfortunately makes their kidneys more vulnerable to those immune complexes we talked about.
that's really vital information. Okay, zooming out a bit, how common is Lyme disease in dogs?
It really varies a lot depending on where you are and how many infected ticks are around. In areas where it's endemic, think parts of the U.S. Northeast, the upper Midwest, and Central Europe, maybe 2% to 10% of dogs might test positive for antibodies.
So they've been exposed.
Exactly. They have antibodies, meaning they've encountered Borrelia. But, and this is key, not all those dogs will actually get sick. Exposure doesn't automatically equal disease.
Right, that's the seroprevalence you mentioned, just
Yeah.
the percentage showing exposure signs.
Correct. Whether they develop clinical signs is another story. And things like co-infections, being infected with other tick-borne diseases at the same time, might also play a role in how sick a dog gets from Lyme.
Makes sense. And geographically, where should people be most aware?
It's mainly a Northern Hemisphere issue. North America, Europe, parts of Asia. In the U.S., the hot spots are really the mid-Atlantic states, New England, the Northeast in general, and the upper Midwest.
Right.
There are also pockets on the West Coast and in some adjacent states where conditions are right for it. In Europe, it's widespread, but maybe a bit less common right along the Mediterranean coast.
All right, so it's definitely tied to specific regions. Let's talk about the ticks themselves. How does the bacteria actually get transmitted?
It's carried by specific types of hard-shelled ticks, the Ixodes genus.
Ixodes, like the deer tick.
Exactly. In the eastern and midwestern U.S., it's mainly Ixodes scapularis, the deer tick or black-legged tick. Out west, it's Ixodes pacificus. Europe has its own main players, like Ixodes ricinus.
And the tick has to bite, obviously. But does the transfer happen instantly?
No, and this is crucial for prevention. The tick generally needs to be attached and feeding for at least 18 hours, sometimes longer, to successfully transmit the Borrelia bacteria.
18 hours. Okay, so finding and removing ticks quickly really matters.
It makes a huge difference. That daily tick check, especially after being outdoors, is so important.
Definitely.
Right.
Can you walk us through the tick's life cycle? How does the bacteria get passed along?
Sure. The Ixodes tick life cycle usually takes 2 or 3 years. It starts with eggs late in the summer. They hatch into tiny larvae.
Okay.
These larvae take their first blood meal, often from small animals like mice or birds, and that's usually where they pick up the Borrelia bacteria if the host is infected.
So the infection starts early in the tick's life.
Often, yes. Then, the following spring, those larvae molt into nymphs. Nymphs need another blood meal, and they are very effective at transmitting Lyme to their hosts, dogs, humans, whatever they bite.
Are nymphs the main culprits then?
They're a big part of it because they're so small and hard to spot. But then later in the summer or fall, the nymphs molt into adult ticks.
Right.
The adult females need a big blood meal, often from larger animals like deer, before they can lay eggs the next summer. And they can transmit Lyme too. Adult males, though, generally don't attach and feed for long, if at all.
So it's mainly the nymphs and the adult female ticks we need to worry about passing Lyme to our dogs.
That's right. The nymphs are particularly tricky because of their size.
Okay, makes sense. So we know how dogs get it, what it does, which ticks are involved. How does a vet actually diagnose it? It sounds like it could be tricky.
It definitely can be. It's usually not based on one single thing. It's more like putting pieces of a puzzle together.
What kind of pieces?
Well, the clinical signs the dog is showing, do they fit the picture of Lyme? Does the dog get better when treated with antibiotics? Have other possible causes been ruled out? What do the lab tests show, especially antibody tests? And, importantly, does the dog live in or travel to an area where Lyme is common? Has it likely been exposed to ticks?
Right, the whole context matters. So what are those common clinical signs vets look for?
The classic one, as we said, is that recurrent lameness from arthritis. It might be a limp that shifts from one leg to another, or it comes and goes.
Okay.
The affected joints might look swollen, feel warm, and be painful if you press on them. The dog might seem reluctant to walk, have a stiff gait, maybe walk with its back arched.
Poor things.
Yeah, and just generally seem sensitive to touch. Sometimes there's a fever, maybe they're not eating well, seem a bit down alongside the joint issues. Oh, and sometimes the lymph nodes near the bite site might be enlarged.
I knew someone whose dog had that shifting lameness.
Hmm.
Took a while to figure out it was Lyme. Could be subtle sometimes, can't it?
It really can.
And what about the kidney signs? What would point towards that more serious form?
If Lyme is affecting the kidneys, causing that glomerulonephritis, the signs are different. You might see things like vomiting, diarrhea, not eating, weight loss, drinking, and urinating a lot more than usual. Sometimes even swelling in the legs or fluid building up in the abdomen. And a big red flag in lab tests is finding protein in the urine.
Wow, quite a range of symptoms. And some sound pretty general, which must make diagnosis harder.
Absolutely. That's why ruling out other conditions, what vets call differential diagnosis, is so important.
What else might look like Lyme?
Well, other tick-borne diseases like anaplasmosis or ehrlichiosis can cause similar signs. There are also various immune-mediated joint diseases, even some breed-specific orthopedic problems. Vets use specific tests to help sort these out.
So those lab tests are key. What specifically are they looking for?
You know, standard blood work, a CBC and biochemistry panel, and a urinalysis might actually look pretty normal if the dog only has the arthritis form of Lyme.
Oh, really?
Yeah, but if the kidneys are involved, then you'll likely see changes like signs of kidney damage in the blood work, definitely protein in the urine, maybe changes in cholesterol or protein levels.
Okay. What about testing the joint fluid itself?
If they take a sample from a swollen joint, it usually shows inflammation specifically, a high number of white blood cells, mostly neutrophils. But the most specific tests for Lyme target the antibodies the dog's body makes against Borrelia.
Right, the antibody tests. Are there different kinds?
Yes. Some older tests just broadly indicate exposure sometime in the past. Newer ones are more helpful.
Oh, so.
While tests like the Western blot can help tell the difference between antibodies from a real infection versus antibodies from a Lyme vaccination.
Oh, that's useful.
And there are quick in-clinic tests, like the SNP test many vets use. A common one looks for antibodies to a specific Borrelia protein called C6.
C6.
Yeah, the C6 peptide. The advantage is this test usually only turns positive with an active or recent infection, and it generally doesn't cross-react with vaccine antibodies. Plus, after successful treatment, those C6 antibody levels tend to drop, sometimes disappearing completely over several months.
Being able to tell infection apart from vaccination seems really key.
Mhm.
What about x-rays? Do they play a role?
X-rays can be useful, yeah. They can show if there's extra fluid, effusion in the joints. They also help rule out other problems like bone injuries or different kinds of arthritis.
Okay. And can you test directly for the bacteria? Like find the actual Borrelia?
Technically, yes. You can try to find its DNA using PCR or try to culture it from, say, a skin biopsy or joint tissue.
Good.
But honestly, in regular veterinary practice, these methods aren't very reliable or practical. They're often slow, and the bacteria can be hard to find, especially in blood samples. They're usually negative, even in infected dogs.
Because it's hiding in those collagen-rich tissues we talked about.
Exactly. It makes direct detection pretty challenging in a clinical setting.
Okay, so diagnosis is really that puzzle history, signs, ruling things out, and those antibody tests. Once you have a diagnosis, how do you treat Lyme in dogs?
The mainstay of treatment is antibiotics.
Which ones?
Doxycycline is very commonly used. It's often preferred because it also hits other tick-borne agents like anaplasma, which dogs can sometimes have at the same time.
Makes sense. Any alternatives?
Yes, amoxicillin or azithromycin can also be effective. Treatment typically lasts for about 4 weeks.
4 weeks, okay.
And it's important for you to know, while antibiotics usually work really well to clear up the symptoms, like the lameness,
Yeah.
they might not always completely eliminate every single Borrelia bacterium from the dog's body.
So the infection could still be lurking, even if the dog feels better? What does that mean long term?
It means recurrence is possible, which is something vets keep in mind. But generally, the antibiotics provide significant relief.
Are there side effects to watch out for with these drugs, like doxycycline?
Sometimes, yeah, doxycycline can occasionally cause some stomach upset, maybe vomiting. Giving it with food usually helps minimize that. Following the vet's dosing instructions carefully is key.
Good tip. What about other things owners can do? Supportive care.
Mostly just common sense things, keep the dog warm and dry, maybe restrict their activity a bit while they're recovering, especially if their joints are sore. Diet usually doesn't need changing unless there's kidney involvement. And vets will usually stress the importance of finishing that full 4-week antibiotic course, even if the dog seems back to normal sooner.
Don't stop early just because they look better.
Exactly. And, it's also a good time to remind people that if their dog was exposed to ticks, they might have been too. So human tick precautions are important in that household.
Good point. You said the infection might not be totally cleared. Can Lyme come back then?
Unfortunately, yes. Some dogs can have symptoms flare up again weeks or months later.
Oh, no.
But the good news is these relapses usually respond well to another round of antibiotics.
Okay, that's reassuring. Are there any really serious long-term worries?
The biggest concern, although relatively uncommon overall, is that potential for severe, sometimes fatal kidney failure, especially as we mentioned in those predisposed breeds like Breeders and Labs.
Which just brings us back to prevention being paramount.
Absolutely.
So what are the best ways to prevent Lyme in the first place?
It's really a multi-pronged approach. First, just physically removing ticks. Check your dog daily, head to tail, especially after they've been outside in potentially ticky areas. If you find a tick, remove it promptly and carefully. Getting it off within that first 18-24 hours can often prevent transmission.
Okay, manual removal first. What else?
Then you've got tick prevention products. Lots of options here, spot-on treatments you put on their skin, sprays, special collars, even pills or chewable tablets now.
How do they work?
They generally contain acaricides, which kill ticks or repellents or both. It's really important to use a product recommended by your vet and one that's specifically labeled for dogs.
Why specifically for dogs?
Because some ingredients, like permethrin, are very effective and safe for dogs, but extremely toxic to cats. So you have to be careful, especially in mixed pet households.
Very important safety note. What about vaccines? Are there Lyme vaccines for dogs? Yes, there are. The current vaccines mainly target a protein called OSPI outer surface protein A, which is on the surface of the Borrelia bacteria when it's inside the tick. How does targeting that help?
When a tick bites a vaccinated dog, it ingests the dog's blood, which now contains antibodies against OSPI. These antibodies attack the Borrelia right there in the tick's gut, stopping them before they can even migrate out of the tick and into the dog.
Clever mechanism. Are they effective?
Studies show they can significantly reduce the risk of infection, especially when used alongside regular tick preventative products. There are a few different types available. They need an initial series of shots, then typically annual boosters to maintain immunity.
So a good option for dogs in high-risk areas.
Definitely worth discussing with your vet if you're in an endemic area or travel to one frequently. It adds another layer of protection.
What about trying to control ticks in the yard or environment? Does that work?
Efforts like trying to reduce deer populations or control rodents, well, their impact on reducing Lyme risk tends to be pretty limited, maybe only effective in very small localized areas. It's usually not a large-scale solution.
Okay, good to know. Wow, we've covered a lot, the basics, the ticks, diagnosis, treatment, and prevention. To sort of bring it all together, what are the absolute key takeaways for our listeners?
I'd say, number one, canine Lyme is a real and significant tick-borne disease. Number two, the main sign in dogs is usually that recurrent arthritis or lameness, not the bullseye rash seen in humans.
Right. Crucial difference.
Number three, consistent tick prevention is your best defense daily checks using appropriate products. Number four, treatment with antibiotics generally works well for symptoms, but recurrence is possible.
And vaccines.
And number five, vaccines are available and can provide valuable extra protection for dogs at risk. Basically, if you're in a tick area, be proactive.
That really sums it up and underlines the need to work closely with your vet, right?
Absolutely. They can diagnose properly, tailor treatment, and recommend the best prevention strategy for your dog based on where you live and your dog's lifestyle.
This has been super informative. It really shows the complex dance between the bacteria, the tick vector, and the dog's own body. It really is fascinating biology.
Which leads me to a final thought for you, the listener. Given all this complexity, the bacteria hiding, the immune reactions, the genetic factors, what other, maybe more subtle things we haven't even touched on, might influence why one dog gets severe Lyme and another shrugs off exposure? Perhaps things related to their unique immune system, or maybe even very local environmental factors.
That's a great question to ponder.
Definitely something to think about, and maybe even chat about with your own vet next time. Thank you so much for joining us for this deep dive into canine Lyme borreliosis today.